We want to welcome everyone to the November 12th V3 implementation call. Thank you for taking time out of your busy schedules to be here with us. We actually have a fairly short agenda, which doesn't necessarily mean a short call, but it could happen. Please keep in mind to have your phones muted until you're ready to talk or contribute to the conversation. We want to make sure that you feel free to ask questions, comment, suggest. This should be participatory and a conversation. So please unmute or use the chat. If you've got a question, we'll watch the chats as well. So with that, let's move down to our agenda. Malik is going to start us off this morning. He's representing the IT team who are not with us this morning. They are in a training all day. So AJ, I'm going to go ahead and turn the time over to you to give us the November maintenance update.
Thank you, Julianne. So the maintenance activities that were planned for the week of November 16th will now be postponed to December due to conflicts that we're having with the Thanksgiving holiday. I'll give that over to Clay.
All right, thank you, AJ. Any questions for IT or for AJ? AJ's our new compliance analyst, so several of the vendors have already had the opportunity to meet AJ and work with him a little bit through compliance. So we're thrilled to have him.
And maybe I can add a little bit to what AJ just shared. Thank you, AJ. I think early next week, Laurel and AJ, Sujata, and the team will come out with more details in regards to what will happen early in December, how that'll be migrated into the first week of December, and what will be accomplished during that maintenance window. So I think that'll be coming. All right, Julianne, okay to move into ET3?
Yep, I think so.
All right, fantastic and exciting topic. We are so grateful for the vendors' interest in kind of engaging early in regards to testing the ability to submit records to the CMS Enclave. We've already gone through the October window for testing, and we are in the middle of the November window. So John, without further ado, I'd love to turn it over to you to have you talk about where we are and some of the other things that are happening on the ET3 side. Okay, we may have lost John for a minute. I'm happy to cover some other issues regarding ET3. I've got two of the issues, so let's let John reconnect and get set back up if that's okay. I'm gonna go ahead and share my screen. There has been an interest shared among the vendors and the states to have a document developed that would help the vendors understand what the constellation of elements may look like when responding to ET3 specific model scenarios. So how might they document based on the current NEMSIS elements in 3.4 and the custom values and custom element that has been added to support ET3. Vendors would love to see kind of how that flow will happen. So what's the sequence with which the elements ought to be provided for those type of calls, and then also for training purposes for those agencies that are participating in ET3. What does CMS expect to see in regards to which elements based on scenarios? So we're working through something that looks like this, that for like an alternative destination call or for a call where perhaps treatment in place can happen, what we would just traditionally or commonly expect to see in regards to values associated with NEMSIS elements and custom values that are associated with ET3. We're working through, we're ready to release this, but I'll just share briefly the guidelines associated with it. We're still working through those. Those deal with, well, what happens if like multiple options are offered, and how would you document things like that if you're in the middle of a telemedicine and power goes out, you know, or you lose connect, things like that. So we'll try to provide some more detailed information there. There was kind of connected with this request that this document have a slightly different approach. That is, how will we document a, for example, alternate destination call for billing, right? So the two are closely connected. In fact, they're probably very closely connected, right? But really the guidance associated with billing is probably much more detailed and complex than this. So we're trying to separate out those two items. And I think Neil may be covering in just a couple of minutes some information that will help the vendors and maybe those participating understand a little bit better the billing questions related to this. So this is soon to come out. We're hoping to finish this next week and get this out. And so this can be helpful for you as a vendor. It can be helpful for the state folks that are on the call to help them understanding how we'll be documenting these calls that are associated with ET3. I'll pause just real quickly and see if there are any questions and if this is meeting the need that's been expressed on the last two calls, I think, as we've been working through there with CMS. Any questions related to this work? Okay, hearing none, we'll continue with this work. Thank you for supporting this and helping us realize the importance of getting this put together. I am thinking that once we tried to incorporate some billing information into this document to make it more expansive, but clearly it's probably best that they be separated just so that there's a kind of a clear understanding about each, even though both will be very dependent on data collection. The other thing I wanted to cover just real briefly is this idea that we may have ET3 participants, that is EMS agencies that want to participate and have even been approved to participate, who are collecting data either on version 2 of NEMSIS, we're finding that to be true, or they are utilizing a version of NEMSIS that is 3.3.4 compliant. And I just want to put out the statement now. We have had extensive conversations with CMMI about this, the ET3 representatives, and working through the processes of learning this information. And just to put it out there, the CMS Enclave will only be accepting data that's in a 3.4.0 format. Right, so what that means, I think for many of these agencies that have these older versions of NEMSIS, they've been relying on a translation before the data enters a state data set or state software product that may be 3.4 and the state requires 3.4, right? So they're doing a translation. That translation, I think, that's mostly used is available on the NEMSIS website. So I'm just putting that out there for both the states and the vendors to start thinking about if you have agencies that are participating on some of these older models of NEMSIS, we're going to have to work through the process of translating that data before it enters the CMS Enclave. So any questions about that idea?
Hi, Clay, this is Samantha with ESO. So to be clear, there are states that are only accepting 334. So you're saying that in the instance where a state only accepts 334, the data should be collected in a 3.4 environment and then translated to the state in 334 to participate in T3?
Yes, Amanda. So that is a great comment. Thank you for bringing that up. So that is another kind of complication to this that we'll have to figure out and work through. But yeah, in regards to the data that will hit the CMS Enclave, they're expecting a 3.4.0 format. So what that means, Samantha, in regards to states that aren't requiring 3.4.0 or even accepting 3.4.0, we'll have to work through that. But I think bottom line is we need to start having those discussions because the CMS Enclave will be using 3.4.0.
All right, so I'm a little concerned with the idea of under 60 days going in and converting a agency to the NEMSIS 3.4 version if they're used to collecting on 3.3.4 to participate in ET3.
Yeah.
I don't see any good alternative for translating from 3.3.4 to 3.4 and giving ET3 all the information they would want.
Yeah, thank you, Samantha. Great comments, and appreciate it. And actually, some of your early warnings to us is what led to the lengthy conversation. So I think what we better do is maybe put together a small working group that can act on this quickly. And I'll reach out to Eric at NHTSA and then also to Neil and John at ET3. They're on this call and hearing the conversation. So we'll get together and see what we can do from our end. I'd like to completely understand some of these particularities, and so the things that Samantha has shared have been incredibly helpful. Are there others that have concerns that don't align with Samantha's that we need to kind of know about as well as we kind of move forward to make sure that this is addressed?
I was going to say, I think there was something put out by the NEMSIS TAC to upsample a 3.3.4 into a 3.4.0 format. Would that satisfy the need that they're having?
The one big problem with that translation document is it still doesn't provide a decent translation for e-disposition 19.
E-disposition 19, okay.
Which is in 3.3.4, condition of patient at destination, and in 3.4.0 becomes final patient acuity.
Oh, right. Yeah, that one. Yeah, that one is clearly the most complex of the move from 3.3.4 to 3.4.0.
And there's not a mapping. When I looked at that particular document, I did not see like value to value mapping for that element. Okay,
fantastic. Yeah, thank you. Yep. For pointing that out specifically, Samantha. Yeah, and thank you, David. Other comments? Okay, great. Yes, Samantha, we'll touch back with you right away and see if we can set up some talks just to make sure that we completely understand the situation, how we might best be able to offer some help. We'd love for all the agencies who have went through all the effort to prepare the internal system to support the model, the ET3 model, that they be able to participate right away, right? And you're right, time is short. So thank you.
Yeah. And one question, should the states that only accept 3.3.4 be involved in that conversation if they have ET3 participants? I mean, I know Texas is a big one. North and South Carolina are 3.3.4 only. Oklahoma's 3.3.4 only. There's quite a few. It's not just,
one or two. Yeah. And that's exactly right. Yeah. Those states will need to be involved in those conversations as well, I think. And they'll want to be.
Yeah.
So yeah. Thank you, Samantha. That's helpful. All right. Fantastic. I when sharing my screen, I can't so much see the participant list. Was John able to make?
Hey, Clay, I'm back. I'm back online. Yes. Sorry about that. I can go ahead and do a quick update if you want.
Oh yeah, please do. Yeah, thanks, John.
All right. Sorry, everybody, for that mishap. Just real quickly, you should be able to see my screen. So yeah, we're really engaged right now in the November testing. And as some of you know who are participating, we really are focused on having the group request a security key and then do some PCR submissions. So that's really the scope of this. We've got some test accounts that we've created. And during the process of the security key request, you're going to be, we're exercising another portion of our team, which does the approvals. and then allows for you to go ahead and get those security keys. So all of that is within the scope of this November test. It's only going to be a week, so from the 9th to the 13th. I say only because we are going to be supporting some additional testing later in the year in December, and I'll share some of that with you. There's about 8 vendors that we're right now engaged with. And from the last October test, we were able to compile a list of suggestions. Some of them are very easy ones. And by the way, I want to thank you all for providing us with all the suggestions that we have, not only on the list that you've seen from me, but I've gotten emails from other folks as well that were very good suggestions on how to improve our user interface, as well as some other aspects of the solution. So I'm going to give you an update in tomorrow's meeting at 12 noon on the suggestions list that we have. So we're working internally so that we can get some very pertinent updates to you before we close out this testing cycle. We are providing scenarios and data, again, this test cycle as well. And a few of you have gone ahead and submitted some of your own scenarios, which is what we encourage. So continue to do that. And as I mentioned, we are having daily calls. Because of this meeting here running to 12:30, we're going to cancel the 12 o'clock call. I talked to the folks internally, and we just thought that would be the best thing, so we don't have people conflicted as to which meeting to attend. So just save some of your thoughts for tomorrow's meeting. And again, we'll make sure we have a good conversation with you on some of your issues, as well as some of the suggestions that you've made. And then ultimately, yeah, the TAC group is the folks that are doing a lot of the coordination. So I just wanted to point that out. Just real quick, we do have some goals in this testing cycle. The number one is to work with individual users directly. Anyone having any connectivity issues or anything, other issues in particular, we've got a dedicated person who is just pretty much there to field issues and questions and work with you individually. The second thing we've thought about doing is making sure there's a copy of a successful SOAP message that all the vendors can reference. And that will give you a sense of what to be expected when you receive back anything from the CMS test environment. So that is something that will be available soon. We also are thinking about having a report that shows all the SOAP requests that have come in. And that will be, again, something that will allow just a little bit of insight into what it is that's being sent and how it's being received, successful or unsuccessful. And then logging. Logging is a big part of us doing any troubleshooting. And we want to make sure we have that enabled in the CMS infrastructure to the point where we can track any of the IP addresses that are coming in. So that's going to help us validate the IP address against those keys that were issued. And I just want to point out that that is another goal here during this test cycle for the folks on our side. For those folks that haven't, as of yet, signed up and done any testing, I just want to give you a sense that this is a pretty straightforward environment or step that you have to take in order to participate. And this slide here is just an overview of our portals and the system. So vendors can come into the enterprise portal, and because we have a test ID already for you, you can use your username and password once you get to the Innovation Center portal. And that will allow you to get into the data exchange platform. The only need here in this test environment for this platform is to request a security key, because after that, you're going to be using an API to issue all your requests. So I just want to point out that it's a pretty straightforward environment. You don't have to be afraid of any of the details not being worked out, but it is a step-by-step process. This is what we've set up not only for now, but also for January. So when January comes around, when you do come to the enterprise portal, you're going to be actually registering. And so keep in mind, there's going to be a little more involved in January, but ultimately these are the steps here that you're going to end up taking. And talking about our next testing cycle, we have a December test cycle that's coming up. And some of the things there we want to do is mirror production as much as possible. So there's another environment that we're going to be doing this, what we call the implementation environment. And it is not production, just so you know. But we do still want to maintain some of those rules we have in tests, which is not to issue any PII or PHI data. But it is going to closely mirror production. So some of those suggestions that we're going to talk to you about next week on the list, those will be implemented in this environment. So that's something to look forward to, and we can, again, do some additional testing. The scope of that test, we may be able to get in vendor registration, which means you would actually come in and register, which is a step that right now we're not taking because we're issuing you some test accounts, but that is a scope that we're trying to achieve for this next December test cycle. So stay tuned. I hope we can get this in. It will be a good thing to do. The testing dates here are from December 7th through the 18th. So now we're going to be giving you a 2-week cycle, if you will, as opposed to a week. And hopefully we can get all the testing that we need to get into that period of time. We also have, again, scenarios and data that we'll be providing. And we're going to do our daily calls as well. And NEMSIS is going to still support us in handling the team coordination. I just want to deliver that message and just, again, thank everyone that's been participating up until now. And we couldn't do this without this participation from this group. And Clay, you and your team as well. I just want to thank everybody for helping us out. Before I close out, I'd like to just bring in Neil. Neil, did you have anything else that you wanted to share with the group?
Yeah, thanks, John. All I want to add is we had a couple questions at our last check-in on Tuesday regarding some more information on billing and payment. And what we have pushed to Dr. Mann and the TAC is we have a 2-pager, a billing and payment fact sheet that is ready to go, and participants, actually the EMS agencies, already have access to. It is a pretty succinct rundown of different codes and destination modifiers that are applicable to ET3 so that proper billing can go through. It also goes through a few things that are definite not dues because that will result in an automatic claim denial because of issues with the format compared to what is normally allowed in Medicare. So my request is that please take a look at that. If it doesn't answer your questions, reach out to us through the TAC or the ET3 mailbox, and we'll try to get it answered as quickly as possible if you have particular questions that you really need answered with your software and your support for your EMS agencies. I also ask that if you haven't already been in touch with the EMS agencies you're working with, they have access to these documents and even more in-depth documents that get into some real nitty-gritty on that. So work with them as well too to make sure everybody's on the same page, but they can also share information with you. And then finally, on that note, on billing and payment, there will be a webinar that is dedicated to billing and payment on December 9th. We can also push that information as well as how to register through the TAC. I know that's about a month from now, so it may not answer questions in time. So that's why I'm asking if there's any particular time urgent ones you have. Please look through the 2-pager billing and payment fact sheet as well as feed some questions up to us, and we'll get them addressed as quickly as possible. So thank you.
Okay, thank you, Neil. And Clay, back to you.
Yeah, thank you, John and Neil. Appreciate that overview. That was incredibly helpful. I'll just quickly perhaps share the document that we've received from Neil that we'll be posting hopefully today and make this available on the website. We'll send out an announcement via the Google group and the DMC listserv, and so folks will know that that's posted. Any other questions to either Neil or John regarding the work that we have been doing to prepare for ET3 launch?
They said they're going to cancel the meeting today, but we didn't get any notification about that. There might be people who are planning to be on that call that are not on this call, so probably a more notice would have been really welcome there.
Yeah, I appreciate the comment. Yeah, unfortunately, we had an early discussion on it this morning. What I'm going to do is probably get on the call anyway, and just to allow for folks to understand that we're not going to, do the call in the same way that we did, have done in the past. But I apologize on short notice. Yeah, but it will go out that the meeting is canceled. But thanks a lot for for that feedback.
Okay, and so there's only one more meeting left for tomorrow, correct?
Yeah, that's correct. That one is an important one. I hope folks join and participate because we'll have some feedback on the suggestion list. And that's going to be the last one for this November test cycle until December. Yes.
Okay,
Yeah, John,
and
I'll just mention. Oh, sorry.
Oh, sorry. Was there any summary about the Tuesday meeting? I didn't see anything about that. Was there a recording done or any products from that meeting?
Yeah, I don't have anything to provide today, but I certainly will have something tomorrow for that. So I can certainly share what I have with the NEMSIS TAC folks, and they can distribute it on to the vendors. So that is something I plan to do. Okay,
but that include the known issues list we discussed before?
Yeah, that'll include that. Yeah. So obviously there'll be some updates that we're making because we'll be addressing specifically some of those items on the list. So, but that list itself will be available, and I'll distribute that through Clay and his group.
Okay, great. Thank you.
Yep.
Yeah, thank you, David. And John, I just imagine, I know you've been open to, direct emails from the vendors. So I assume if folks are doing some work, did some work yesterday after the call or doing it this morning, they could probably still reach out if they had technical issues, right?
Yes. The help desk has been open and available all this week, and certainly they can reach out after this test cycle as well. So yes, that's true.
Thank you, John.
Yep.
All right, fantastic. Yeah, please.
We've got one question in chat, and that's if tomorrow's meeting will be recorded.
Yeah, it will be. That meeting is, again, going to be the standard one that we have at 12 noon, and we'll record that as well. Yes.
All right, any other questions to Neil or John? All right, fantastic. Thank you. Really, really good discussion. I just have one other small point. I think I'm up next, and that is to talk a little bit about the development of state level performance measures dashboard. I just wanted to let folks know that this is in the works. So we've over several years now provided an API that software vendors can hit to provide comparison data or benchmark data for performance measures that were first defined by the Compass project and then were taken up by NEMSIS. And that API is active, and we every 3 months attempt to add another performance measure to that list. And now the list is getting quite extensive for the elements that we've included in the API. And associated with the API, of course, is a dashboard that we make available. And I apologize, we're trying to fix the fact that this blue bar does not travel over as it should. So we're working on that as we speak. But did want to mention this has always been available in the NEMSIS website, in the dashboard specific for EMS providers, and in the dashboard specific to the public, with the idea that if an API is utilized by a vendor, and so an individual agency can see their performance in regards to any of these measures, they could have directly in front of them benchmark data on a more global sense, right? So national data to be able to compare. And I know a lot of vendors are utilizing this, and we maintain this one on the NEMSIS website just in case there are those who don't have a product that provide that benchmark. They can go in here, of course, and identify the type of agency that they have and compare themselves to what they're seeing in their data, right? So regarding these performance measures, there's been a request that we actually just build out another version of this national tool that would provide state level benchmarks that the state data manager and state EMS officials would have access to, so that they could also be communicating with their agencies about the performance on these measures. So that work is underway. And I just wanted to bring that to the attention of this group, and that I think this idea of providing these performance measures is going to continue to grow and become more important, right? So as vendors are considering their front ends to show the data and their back ends to acquire the data through the API, I don't think that this is these measures are going away, right? There was some concern about the move from the Compass project to NEMSIS, but I think it will continue. So just wanted to bring that to folks' attention. Any questions regarding future work in regards to the performance measures? Oh, great. Let's see. We have a question. Could you make those state measures available to not just state managers? That's a great question, Jason. And we can. We have a new. We've developed a new security type where we can identify specific people who have access to just specific dashboards. So that's a good question, Jason. I'll get back to you with some information regarding that. Thank you for the question. Any other questions? Okay, great. Let's see, Jeremy, is there a resource page for accessing the API? Yes, there is, Jeremy. Let me send that to you. Thank you for the question. All right, any other questions? All right, great. That was just basically informational. Oh, okay. Neil's going to jump off. He thanks everyone for the opportunity to participate in the call. I think that went very, very well. All right, I've just got one more informational item just real quickly, and that is to let you know that conversations continue at the national level as well as at the state levels in regards to the future of vaccinations and how we might capture the data associated with not only the vaccination of our professionals, but also if EMS is asked to participate in larger community vaccination programs. So we're trying to be a little bit ahead of that curve. Image Trend, Kelly at Image Trend was kind enough to pass on to us the request that she has received to date from states as they prepare to think about this process as well. I just wanted to bring it up again. If you would be so kind, if you as a state or as a vendor have had other conversations and are kind of solidifying or finalizing the idea regarding a question you'd like added that would be completed by EMS professionals, we'd love to be a part of those conversations, or at least seeing what you're planning to do so that we can kind of help to ensure that if there's a common theme that develops among the states as to how they'd like to collect that data, we'd like to try to help to keep that standardized across the country and perhaps provide information at the national level if that becomes important, right? So feel free to pass that along. Would also just like to call the question quickly, have states or vendors continued in those calls? Are there things that seem to be solidifying for you where you feel like there's some specific questions that are surfacing that they'd like the EMS providers to be involved in completing? All right, well, appreciate your attention in regards to that topic. If anything comes up or something comes to mind that you want to make sure that we're in tune with in regards to what's happening, feel free to reach out to myself or Eric. Julianne, I think that's all my topics. I'm going to turn it back over to you.
All right, sounds good. We'll put the agenda back up, and Eric is next up on the agenda for items from the Office of EMS.
Hi, good afternoon, everyone, or good morning, everyone. I don't have anything specific related to the ET3 topic other than to thank you all for your time and diligence in making this work. I do have one kind of walk-on topic, and I don't even know if Clay has seen this yet, but we a couple hours ago received, or an hour ago, received a request from ONC, also National Coordinator, asking us to schedule something, it looks like in relatively short order, to discuss with vendors EMS fire FHIR based standards. They're asking for some input from the EMS community, and our request is how to engage, I guess it would be the vendors and the data managers. The actual comment is thinking about like a one-day meeting to engage the data managers. They're asking if there's something already planned. I just put that out there to tell you, stand by. You're going to hear more information apparently on that in the very near future. We'll see if we can't coordinate it with something that's already scheduled. But this is a request coming from them. Apparently, they got to a point, someone realized they would like to get some EMS specific information, which is awesome, and they're reaching out to do that. So it'll be relatively short notice, but we're giving. I received it an hour ago, and you're getting the notice now. So that's about as quick a turnaround as I can possibly get for you. So more information to come on that. Otherwise, just please keep us informed if you hear questions or concerns regarding the ET3 implementation, and we'll help work them out as best we can. Other than that, just a general comment. COVID right now is for those of you tracking things, if we would look back at EMS by the numbers, it seems to me we're back to week 11, despite all the lessons learned and efforts made. So I just say that to tell you, please take care of yourselves, take care of your families, and make sure you're making wearing masks and social distancing a priority in your life, because we need all of you to execute and support the mission of EMS across the country. So please take care of yourselves. With that, Julianne, unless anyone has any questions for me, that's all I have for the group.
Any questions for Eric? Anything for open forum? Any questions, comments, concerns that anyone would like to bring forward?
I was going to mention briefly what we were talking about, Julianne, the email you sent. So the kind of the confusion around some of the signature elements and whether that needs to be, maybe somebody here on the call has more details about that. So you mentioned how the signature status has a signed, not patient status. And I was kind of unsure how that was supposed to be used. And then we also have that the element for type of patient representative, but there's no rules about it to say that you're only going to fill us out when there's a patient representative as the signer.
It's a good topic, David. What David's referring to is some questions that he brought forth for 3.5 and on some of the other elements for signatures. That would be a really useful conversation, especially to get some additional guidance along the lines of that for the V3.5 documentation. Let me put together some of that information so that on our next call or the one after, we can just have everybody up to speed and have it really clear what the ask is as far as the input on making sure that the signature elements are accurately described and that we have all of the appropriate values for it.
Yeah, you'd sent me some questions on email, but I wasn't sure how to answer because those are kind of my questions. And so I'm like,
I was hoping you had the answer, David.
Right. So, yeah. So another call sounds good for that.
Okay, thank you. And David brings up a good point. As you look at implementing 3.5, if you've got feedback, questions, suggestions, we're collecting all of that input from state data managers and vendors so that as we do the next update, that we're just constantly making sure that we're finding any place that needs to be adjusted and tweaked for the next iteration. Any other questions, comments, concerns? Okay. Our next meeting is November 25th, the day before Thanksgiving. It will be a short meeting, but we just, especially with ET3 and COVID, we didn't want to cancel any of the meetings during the holiday season just because there's so much going on, but it will be a short meeting. The next ones will be in December. I just am checking chat, making sure that if there's any other questions or comments before we close out. Please let us know if you have topics that you would like addressed during these meetings. We're happy to take those suggestions as well so that these meetings can be as productive and informative and valuable for our stakeholders.
Julianne, I have a little bit more of an update on the maintenance part of the call.
Oh, great.
Yeah. So the plan here is that we're going to be performing some maintenance during the week of November 16th through November 20th to upgrade our system to accept the V3.5 records. The NEMSIS submission web service and the record processing are projected to be offline while we do that. Now, this was originally for November 16th at 9 a.m. Mountain Time through Wednesday, November 18th. But that is what has gotten moved now to December. The EMS data cubes will be offline during the entire maintenance period. So there may be some other small service interruptions to other NEMSIS reports and services, but we're going to send out some email notifications to start and end any downtime expected to exceed over about 30 minutes. If anybody has any additional questions or concerns, they can reach out to myself or Laurel, and I will put our contact into the chat.
Thank you, AJ. Our IT group is really good about sending out those email notifications, and those come through the Google group messaging. So we appreciate you doing that. The recording of this meeting will be available on our website and on our YouTube channel by tomorrow. We're usually about a day getting them processed and time-stamped before they're put on our website and YouTube channel. Thank you, everyone, for taking time out of your busy schedules to be with us today. Wasn't too long of a call, and next time it won't be very long either. But please let us know if there are topics that need to be addressed in this forum. We've got such a great group of stakeholders. Lots of great minds come together for this call. Thank you for your time. Be safe, and we will see you in a couple weeks. Thanks.